Health and Family Welfare Minister Paiwang Konyakpra aji Pradhan Mantri TB Mukt Bharat Abhiyan laga nichide 100-day active case finding campaign aji launch kurise. Sekhazo D Khel Ground in Kohima village te. Program de kotha kuriya homoy Commissioner and Secretary Health and Family Welfare Anup Khinchi bra Nagaland de 2023 de 284 active TB cases detect kuriya example loigina itu campaign la important support kuise. Tai community members, public representatives, local bodies, self-help groups aro NGOs khan sob miligina by 2025 te state pra tuberculosis bimar do hatai dibole matise. Minister Paiwang bi kotha kuriya homoy kuise itu campaign do program ekla noy. Itu do hope, health aro empowerment mission ase. Paiwang kuise tuberculosis to ekta bishi purana bimar ekta ase kunde public health challenge kure aro countless manu laga jan affect kuri ase. Kintu ajibra itu deadly disease to haribule community driven and patient centric solutions implement kurias. Minister Bra janaise 100 days intensified campaign do India the 347 selected high priority districts cover kurias. Nagaland the campaign districts khando Kohima, Mon or Wokas. Tai kuise next 100 days te itu initiative pra TB khilaf frontline battleground hobo kintu itu bra napunja manu aro jaga khande punchigina TB cases khan sabo.
Services. The campaign is crucial to improve the public health across the state by registering significant reduction in TB cases and mortality rates. The campaign is to cover 3 high priority districts of Nagaland, and that is Kohima, Mon and Vokha. The campaign needs active participation of all of us. And so we solicit the support of our MPs, MLAs, urban local bodies, all the public representatives, state and district line departments, public sector enterprises, civil societies, NGOs, self-help groups, and public representatives.
The strategy of this campaign employs a comprehensive database approach to reduce TB incidence and death. These strategies align with the India's commitment to the Sustainable Development Goals, addressing both social determinants and healthcare gaps. The campaign aims to, number 1, increase case detection by raising community awareness and intensified screening and testing in high-risk population. The campaign will target the vulnerable groups, including the household contacts, individuals with a past history of TB, diabetes, people living with HIV, undernourished individuals, smokers, alcoholics, over 60 years of age, and people of congregate settings and workplaces.
Tuberculosis can infect our muscles, bones, skin, even our hair can get infected by tuberculosis. I, as a surgeon, I've seen a lot of intestine TB, kidney TBs. I have operated a good number of brain TBs. TB can infect any part of our organs. And sometimes when we go for TB tests, especially our sputum, when the result is negative, we are very happy that it is negative. But for the layman, I want you to know that even if your sputum test is negative, maybe 3-4 times, but that does not mean you don't have TB. It just indicates that you may be a closed case of TB. It is not an open case. So the skin test may be more sensitive, and which is available in our state now.
Study shows that most doctors will not correctly diagnose TB patients. Even if they did not correctly treat them. Without proper medical guidance, they continue to infect their near and dear ones. Today, the disease or the TB also has mutated. Today, we are challenged with the need to invent generic drugs. India is a leader, but today we are also confounded with elements of the corporation, the interest of the pharmaceuticals. So today, the greatest challenge of our government also is to see whether we can bring our own generic companies to bring down the cost of what we call drugs. So bringing down all these effective changes are necessary. At our state government level, ma'am, Anupama Prasad, I would like to impress you that under the leadership of our Honorable Chief Minister Nimpurio, we had launched the Chief Minister's Health Insurance Scheme. So that proactively gives coverage both for government officials as well as for the, in a small far-flung state like us. We face so many challenges.
Friends, this campaign is not just a program. It is a mission of hope, health, and empowerment. Tuberculosis has been a long-standing public health challenge affecting countless lives, particularly the most vulnerable ones in our society. It robs individuals of their health, productivity, and dreams. However, today, we reaffirm our commitment to end this deadly disease by implementing bold, community-driven, and patient-centric solutions. This 100 days intensified campaign is covering 347 selected high-priority districts across 33 states, union territories, which will involve a comprehensive strategy to mobilize resources, raise awareness through visual, print media, and intensify action against TB. This campaign is a clarion call for people's participation, as it recognizes that only with the combined efforts of government agencies, healthcare providers, non-profit organizations, private players, and most importantly, the communities we serve, can we eradicate TB. Today, by launching this initiative, let us pledge our unwavering support to this cause, reaffirm our commitment to the vision for healthier, TB-free India and Nagaland. This battle will not be easy, but together we will overcome. To all our health workers and stakeholders, I thank you for your relentless dedication. You are the driving force behind this movement, and your efforts will ensure that every patient receives timely care and dignity of life. Let us take this opportunity to create a lasting impact and deliver on the promise of good health for all. Together, let us prove that dream of TB Mukt Bharat is not just a vision, but a reality waiting to unfold in the country as well as in the state of Nagaland. So with this, I will end my keynote address.